I'm Dr. Sreenivasa Murthy TM. Can wax cause dizziness? It's a very unusual presentation. When we see a person coming to us with giddiness as the main complaint, very rarely have we encountered a situation where on cleaning the wax, patients the dizzy feeling has gone. But they can have a very unusual discomfort, saying they're feeling very uncomfortable because of something in the ear. And when we see the ear and we remove the wax, they have absolute relief. So, dizziness is a very abstract term which people tend to use to describe various discomforts that they have. So, probably that's what they mean. Sometimes wax accumulation can also cause pain in front of the ear, pain while chewing, headache, because the joint tends to get impacted. The joint is right next to the ear canal. So, if the impaction is very close to the joint, every time the jaw is moved, you can have some pain, and the muscles which are attached to the joint also can become sore. So, these are presentations with which patients have come, and they all get relief immediately after removing the wax. Now, can it cause any other major health effect? No. So, most of it is because of obstruction. The ear canal gets obstructed. So, your hearing will get dampened. You can have ringing sensation or tinnitus because of wax also. You can have secondary infections that can happen either because of trying to remove the wax and injuring, or the wax has remained there for a very long time and hence eroded into the skin or caused breaches in the skin. Water has entered and then brought in secondary infection. Otherwise, most of the conditions with wax are not any life-threatening or organ-threatening problems. Now, there is a very unusual condition which is called as keratosis obturans, wherein wax will get accumulated with the skin sheddings of the ear canal, and that tends to erode the bone of the ear canal. Now, this is probably one of the most painful conditions in the ear. Now, when this happens, the person probably will need some amount of local anesthesia or very rarely even general anesthesia to remove the wax. And then subsequently, we recommend that these patients come more frequently for oral toilet or cleaning of the ear so that it doesn't cause bone erosion. Now, most persons who come to us and then are told that they have wax or they have had multiple episodes of ear cleaning because of wax accumulation, they ask us, doctor, is anything available to dissolve the wax completely? Now, we have chemicals in the form of ear drops which are available for as wax softeners. Now, the catchword is wax softeners. They are all softeners. They are not agents which can dissolve. If there is some amount of tissue which is surrounded by skin, and that tissue, the secretions which have accumulated there is wax, and it has become so thick and impacted, if I use something to dissolve that, wouldn't it touch the skin of the canal and dissolve the skin also? So, therein lies the difficulty. We cannot use very strong agents to dissolve wax because it will affect the skin which is surrounding the ear canal. And if the skin gets damaged, then it will lead to other problems. So, there is no dissolving agent, there are only wax softeners. And once you use wax softeners, you still have to go back to the doctor so that he or she can clean the wax. If you do not go back, there is always a possibility within the next few weeks the wax will become dry and again cause symptoms. So, many people, they would have used the wax drops thinking that they are dissolvers, and then they will again come back after a few more weeks for completion of cleaning.